Let's see whether it started. Okay. Hello. Yes. Am I audible, guys? Just a second. I think I'm not able to. Okay. Am I audible, everyone? Can you hear me? All right. Okay. So I'm not able to have a look at your messages. Just a moment, please. Yes. All right. Okay. Good morning, good evening, everybody. So, welcome to back to a new series of PSM that we're going to start. It's Target FMG 2021. We are targeting FMG 2021 with some previous year FMG PSM MCQs. All right. I hope I'm audible to everybody. All right. So all those who don't know me, I am Dr. Neha, your mentor and guide for PSM on Unacademy platform. Okay, you can follow me on my Telegram group, on my Telegram channel, also on my Unacademy. For my Unacademy lectures, you can visit my Unacademy profile. Also, you can visit me my Instagram on my this is the account where I keep updating about PSM recent updates, question and answers, and a lot more. All right, so before we begin, just a little heads up for all of you. We at Unacademy have launched a target next 2022 batch. Okay, so we have launched a new series which is target next 2022. All right, so any student who's interested can subscribe to this batch course. It has just started from the month of December, will continue till May. All right, and these are your educators who will be teaching you live on the platform every day. PSM will be taught by me. I will be taking PSM from January 18th till January 28th. It will be a 6-hour session every day starting from 7:30 a.m. in the morning till 2:30 p.m. And we will be doing 54 hours of PSM. We'll be covering under Target Next 2022. So the highlights of this batch is that it will be a concept wise coverage of all subjects, discussion on high probability questions, also coverage of all patterns of questions, and we will also be having doubt clearing sessions for all subjects. Also at Unacademy, we have launched a batch which is target batch for FMG 2021 now. Here we've started it on 14th, and one batch was also started on 28th December. That's just yesterday. So you can still subscribe to this batch course also. These are your educators who will be teaching you again. So you can use my code PSM10 to get a 10% off on this batch also. All right, again, it will be based on concept-wise coverage of all subjects. We'll also be discussing important and high yield probable topics. We will also be discussing all question patterns for the exam, and of course, there will be doubt clearing sessions as well. All right. Okay, so what is the advantage of you guys taking a plus subscription? Number one, you get a daily access to all the live classes that's happening on Unacademy. You also get an access to all live tests and quizzes. You get an access to structured courses and unlimited access to whatever is happening on Unacademy platform. Okay, you can learn live from all your educators and you can clear your doubts as well. All right, so we are also doing an Unacademy NEET PG daily T20 for NEET PG 2022. It's a quiz type of thing. Every day it is done at 9 a.m. so you can attend the test live. Also, we are doing a quiz for T20 for NEET PG 2021, which is at 8 p.m. every day. So you can attend these live sessions also. For my free live classes, it's happening every day at 10 a.m. So if you want to attend, you can attend it. Tomorrow we will be discussing is AIMS 2019 and 2018 PSM MCQ discussion, which will be at 10 a.m. on 30th of December. That's tomorrow. We'll be covering all the previous year AIMS questions. It will also be important in a good session for all FMG students, NEET PG aspirants, everybody. And on 31st, I'm going to end the year with 2 free classes for PSM, which will be, one will be a PSM mini revision series where we'll be covering vaccination, a much requested topic, vaccination with MCQs and images, which will be on 31st of December at 10 a.m. So this is the link for it. You can also attend that free class. All right. Also, we will be having on 31st another free session, which will be at 3 p.m. Here we are going to talk about rapid one-liners and PSM images. All right, so you can attend these special classes. You can also subscribe to Unacademy. Whatever subscription you want, you can use my code PSM10 and get a 10% off. All right, everybody. So are you all ready to start the discussion today? So the first question that we have on board, this is particularly an FMG series, all right, but even the NEET PG students can attend this. So yellow fever vaccination starts protection after how many days? So if we talk about yellow fever vaccine, it gives protection after how many days? Good, Vignesh has put in his answer. Is it 5 days, 10 days, 15 days, or 20 days? Yes, absolutely. The correct answer to this is yellow fever vaccination starts protection after 10 days. All right. And if I ask you, good Arun, it's 10 days. If I ask you students, for what duration does this vaccination certificate remains valid? So vaccination certificate remains valid for anybody? Vaccination certificate remains valid for how long? 1 year, 2 year, 5 years? Very good, Vignesh and everyone. The vaccination certificate remains valid lifelong, everybody. Okay, yellow fever vaccination, once you give it, it starts protection after 10 days and it remains valid lifelong. Okay, these are very important MCQs for your FMG. They've been previously also asked, and particularly this is the new update that it remains valid lifelong, that you should know. Okay, one additional question for all of you: is yellow fever vaccine included in, or is yellow fever as a disease included in our national program for control of vector-borne diseases? Yes or no, anybody? Is the yellow fever disease a part of our national program for control of vector-borne diseases? Yellow fever is not a part of our program on National Vector-Borne Disease Control Program. Okay, it's not a part of this. Very good, good. Sumita, everyone, that's absolutely correct. Let's go to next question. All right, okay. So next question is, okay, a person going for self-health checkup to a hospital as his father, I'm sorry, I think the slide was missed here. I'll just tell you the question. A person going for self-health checkup to a hospital as his father, the question was, suffered from, okay, some kind of heart attack. All right. Now, what level of prevention is this? So this is the question. What level of prevention is it? A person has gone to a hospital for self-health checkup as his father suffered from heart attack. What do you think is this level of prevention? Come on guys, put in your answers. Is it primary, primordial, secondary, or tertiary? Good. So I can see some of you writing primary. Okay, Ankit is writing primary. Vignesh is writing secondary. Dumesh is writing secondary. All right. See, any form of health checkup when we go for, okay, we have one purpose in mind. That one purpose is to make an early diagnosis, okay, to make an early diagnosis of it. Okay, if we are developing some disease, we want to find it at an early stage and accordingly provide the treatment. Okay, take treatment for it. So a person who's going for self-health checkup to a hospital as his father suffered from heart attack, so already risk factor is definitely there, but maybe the disease might be developing in him also, so it becomes secondary level of prevention. Is it clear, everybody? Okay, suppose in schools we have annual health checkups happening, all right. Under a national program for control of blindness and visual impairment, we have eye checkups happening. All those are secondary level of prevention. Am I clear? So this is a very important question. Okay, so let us go to the next question now. Zakaria, were you able to understand this? Okay, anybody who's going for an annual health checkup wants to make an early diagnosis. Risk factors are already there. All right, primordial prevention क्या होता है? Risk factors are not there. Primary risk factors are there, but disease has not yet started. And both of this, primary as well as primordial prevention, happen in where these levels are applied basically in the environment when the disease is in early pathogenesis phase. It has not entered the body, not entered the human body. Once it enters the human body, guys, in natural history of diseases, which is the level of prevention you apply in pathogenesis phase? Anybody? Secondary and tertiary. All right, that means the disease might have started in our body and we are trying to find that out by applying secondary, which is we are doing screening, and tertiary, if the disease has progressed, then to prevent disability and rehabilitation, we are applying tertiary level of prevention. Okay, let's go to the next question. Yes, what is prospective screening? Now, this is from your previous year papers only. Prospective screening is done in neonate for thyroid disease, immigrant screening, pap smear, or diabetes mellitus. So, what is an example of prospective screening? Let me see your answers, everybody. What is an example of prospective screening? Very good. So I can see some of the answers here. Good. Most of you are writing B as the answer. Yes, prospective screening is, the example is immigrant screening. Now there are two types of screening, everybody. Okay, one is prospective screening and the other is prescriptive screening. Okay, what is prospective screening? When you screen people for whose benefit, for others benefit. Okay, and when you screen somebody for their own benefit, all right, then it's called prescriptive screening. Own benefit means, how you can remember it, like you're prescribing a drug. Okay, prescriptive, so you are screening somebody for their own benefit. All right, like you any sexually active female should get a pap smear done, so that is for her own benefit, to see whether she is developing cervical cancer or not. Screening elderlies are at high risk, so if we screen them for diabetes mellitus, it's for their benefit. Okay, immigrant screening is prospective because you're screening them for others benefit. For whose benefit? Like right now in COVID-19, we are screening all the immigrants or all the travelers. All right, why do we screen them at airport? So that, because they are a risk factor to the residents of the place they are coming to visit. Okay, they might be suffering from COVID and they can they are a risk factor for the people there. So immigrant screening is prospective. Again, when you screen a neonate for thyroid disorders, to find out what? To find out neonatal hypothyroidism. Okay, so this is for the neonates benefit. Clear? All right, let's proceed to the next question. Yes, this is again from your previous year paper. Monetary benefit is measured in, your options are system analysis, network analysis, cost effective analysis, or cost benefit analysis. Okay, can I see your answers, everybody? Monetary benefit is measured in system analysis, network analysis. Good. So some of you are writing, Dipesh has written D, Sethi has written D. Good. Rajat is writing D. Good. So Vignesh has written C. So some of you are writing C and D. See, what are these techniques? These are quantitative techniques of health management. Okay, they are very important. All of these are health management techniques. Okay, health management. Now in health management also, when we talk about health management techniques, they are basically quantitative techniques. Okay, quantitative techniques of health management. Okay, so in this, what could be your answer? We measure the outcome of any health program in terms of two things. You can measure it in terms of lives saved, okay, or you can measure in terms of heart attacks avoided, okay, or you can also measure in terms of quali is quality adjusted life year. So when you measure the outcome of a program in terms of non-monetary terms, okay, when you measure the outcome in non-monetary terms, then it is known as cost effective analysis. All right, okay. But when you measure the outcome of any program in monetary terms, okay, in monetary terms, then it is known as cost benefit analysis. Now what do you mean by monetary terms? That means, suppose we say that National Tuberculosis Elimination Program was able to save $20 this year, okay. So we are able to measure the outcome of a program money wise, okay. So that is known as cost benefit analysis. When we are able to measure in terms of life saved, heart attacks avoided, quality of life gained, okay, that is cost effective. Now can you tell me in the comment section, out of cost effective analysis and cost benefit analysis, which one is more better, or which is a comprehensive measure? Anybody? Yes. Many times we cannot measure the outcomes in terms of money, all right, always we cannot do that. So the best management technique, okay, or we can say the most comprehensive management technique, okay, here what is it? It is cost. Anybody? Very good, very good. It is cost effective analysis. This is also your MCQ for the next time they can ask you. All right. Now what are systems and network analysis? Network analysis is a graphical representation or diagrammatic representation of the various activities that would be done in a national health program. Okay. This involves PERT, program evaluation review technique, and critical path method. Am I clear, everybody? And systems analysis kya hota hai? See, whenever you have say, you know, whenever you have two alternatives for any one thing, like for diagnosis of tuberculosis, okay, if I talk about diagnosis of TB, we have two alternatives. It can also be done by an AFB sputum, okay, or it can also be done by a CB-NAT, okay. So when you have two alternatives for diagnosis of a particular thing, or for any one technique, you have two alternatives. We select the best based on cost effectiveness. Are you clear? So this is known as systems analysis. When you select the best alternative based on cost effectiveness, that is known as systems analysis. Okay, give me a thumbs up if all of you have understood this term. They have asked twice in previous year FMG papers. Okay, so you should know this. They've asked it a lot of times. Cost effective is when the outcome is measured in terms of, when it's measured non-money ways, okay. Cost benefit is when it's measured in terms of money. Network is graphical representation. System is when you compare two techniques based on, you know, their cost effectiveness. Very good. All right, let's proceed to the next question. This was asked just now in your last FMG, December FMG. Okay, so tell me, it's a very easy question. One ASHA covers a population of 1,000, 2,000, 3,000 or 5,000. Very good, everybody. So one ASHA worker is based for a population of 1,000. Now what is this, guys? This is the existing norm. Okay, existing norm kya hai? That one ASHA is for 1,000 population. But please put in the comment section, what is the proposed norm for ASHA? Anybody? Proposed norm kya hai for ASHA worker? Let me see your answers. Proposed norm is that there should be 2 ASHA workers per 1,000 population. Okay, this is the proposed norm. All right, good, Vignesh, everybody. All right, now in ASHA worker, we also do certain other MCQs. You know, I can ask you, like ASHA worker, when we say, then who selects an ASHA worker? Anybody? Let me write those points for you. Who selects an ASHA worker? Anyone? ASHA worker is selected by a village panchayat. Okay, panchayat, under the supervision of, selected by a village panchayat under the supervision of a medical officer. All right, then who trains an ASHA worker is another question. So ASHA worker का training कौन करता है? आंगनबाड़ी plus ANM. All right, basically it's ANM plus आंगनबाड़ी worker. All right, what is the duration of training for ASHA worker? 23 days. All right, then What is the education level of ASHA worker? Till what level she should be educated? Anybody? Very good, Vignesh. It's A&M Anganwadi. What is the education level? She should be educated since for 10th class. Now, one more important healthcare personnel that you should remember all these criteria for Anganwadi worker. Okay, how are you going to remember it? A and A. All right. For Anganwadi worker also, what is the criteria of this thing? What is the educational criteria? It's the same. Both the A's have same educational criteria, 10th class. All right. And the duration of training for an Anganwadi worker is anybody. Now, since Anganwadi worker has to deal with children, so the duration of training is more. It's at least 4 months. Clear? Good, everybody. Did you understand this? So this is very important. I've also brought a this thing for all of you, a chart for all of you. This is where we talk about grassroots level workers. Asha mein dekho, village 1 per 1000, 10th class and 23 days. Then look at Anganwadi worker. Okay, A and A. Anganwadi worker is also 10th class. Both AAs are 10th class, but duration of training for Anganwadi worker is 4 months because she's dealing with children. All right, not 3 months, Vignesh, it's 4 months. And one Anganwadi worker is for 1 per 400 to 800 population in plain areas. Hilly areas may 1 per 300 to 800 population. Clear? Then village health guide and trained birth attendant. All of them are based at village. Trained birth attendant ka there is no educational criteria because she has to be trained to carry out delivery processes only. So 1 month training for a trained birth attendant. All right. That's how you can remember it, that she has to carry out delivery process. Okay. So we've just given her 1 month training. Education is not mattering over here. Understood? All right. Village health guide is always a female. All right. This is also 1 per 1000. And since ye guide hai, so we have kept the education criteria a little low, which is 6th class, and the training is 3 months. All right. Multi-purpose worker, male and female, both are based where, guys? They are located at a sub-center. All right. And since they are managing an entire healthcare delivery setup on their own, okay, sub-center, does it have a medical officer? Everybody comment in the comment section, guys. Does a sub-center have a medical officer? Anybody? Does a sub-center have a medical officer? No. Sub-centers do not have a medical officer. So this multi-purpose worker has to be educated up to 12th class. Very good, Zakaria, Sumita, everybody, they don't have. So they have to be educated up to 12th class with a 12-month training. All right, will you remember these grassroots level workers? These are the minimum that you need to remember. How will you remember? Asha, Anganwadi. Study them together. A is 10th class, 10th class. All right. And 23 days Asha training, but Anganwadi worker, because she has to deal with children, so 4-month training. Trained birth attendant, only 1 month training because she has to deal with delivery processes. No education required. Village health guide, 6th class. Okay, she's like a guide. So with a 3-month training, it will work. And multi-purpose worker is maximum 12th class with a 12-month training because they are running they are responsible for running a healthcare delivery system. Got it, everybody? Give me a thumbs up if you've understood this question also. Very, very important. So I've covered a lot of previous year questions from this table. Like you've also got the question of one village health guide is based for a population of so on and so forth. Okay, good. Let's proceed to the next one. Good, Ayush. All right. So similarly, I just gave, this question has not been asked in FMG, but I gave you a question so that you can, study it by comparing an Asha and a Usha worker. All right. So what is an Usha worker? One Usha worker are proposed to work for a population of 1000 to 2500, 2500 to 3500, 4000 to 5000, or 5000 to 10,000. Let me see your answers, everybody. Come on, start marking. What population is one Usha worker proposed for? So one Usha worker is proposed to cover a population of Kish is writing A. कुछ बच्चे B बोल रहे हैं. Some are writing A. All right. Okay. Dumesh is writing A. All right. Good. So good that all of you are trying it. Now see, whenever you talk about the healthcare delivery system of India, everybody has heard about NRHM. This was formulated for rural areas. Okay. The healthcare delivery system addressing the rural areas is National Rural Health Mission. This was formed in 2005. Then what happened? We saw that, we are neglecting all the urban slums or the resettlement colonies. So what about those urban areas? Who's going to look after their healthcare system? So we formulated a National Urban Health Mission in 2013. Okay, finally in 2013, both these NRHM and NUHM came under the overall supervision of National Health Mission. Okay, so just like ASHA worker is the first level of contact between the community and the healthcare delivery system of India, similarly USHA worker, rural healthcare delivery system, similarly USHA worker, all right, is the first level of contact between the community and the healthcare delivery system of India in urban areas. So she covers a population of 1000 to 2500 or 250 to 500 households. Clear? This also is important. This could also be asked as an MCQ. So this is about ASHA and USHA. Let's go to the next question. All right. Best study of first choice for assessment of unknown or best study of first choice for assessment of any unknown or new disease. All right. I think the word has just disappeared. Tell me what is your answer over here, guys. Cohort study, case control study, cross-sectional or descriptive. Best study of first choice for assessment of unknown or any new disease. So I can see a lot of you answering as A, some are answering B, some are answering C, some are answering D. So only one person has got it correct. Vignesh, he says it's D. Guys, I am asking you best study of first choice for assessment of an unknown or new disease. Okay, of an unknown of an unknown or new disease or something new etiology. We do not know anything about the disease. So what are we going to first do? A descriptive study design. The question is not about evidence based medicine. Please remember, this is when nothing is known about a disease. What are you then going to do? Okay, when you study about classification of epidemiological study designs, let us revise that. When you study classification of epidemiological study designs, what is the two major classification? Everybody quickly in the comment section. It is observational and what is the next one? Interventional. Okay, now in observational study design, it's further divided into descriptive, okay, and analytical. All right, and in interventional study design, it's divided into, we can have field trials, okay, we can have community trials, all right, we can also have RCTs, all these. Now, why do you do an epidemiological study design? To either formulate a hypothesis, to test a hypothesis, or to confirm. So when nothing is known about a disease, okay, when we want to formulate a hypothesis, okay, when we want to formulate a hypothesis, we do a descriptive study design. When we want to test a hypothesis, we do a analytical study design. And when we want to confirm a hypothesis, we do an interventional study design. Clear, everybody? So when nothing is known, we go for a descriptive study design. Best study of choice for assessment of unknown or new disease is descriptive study design. Clear? Give me a thumbs up if all of you have understood this one also. Don't get confused with evidence-based medicine. Okay? एविडेंस बेस्ड मेडिसिन के लिए क्या होता है? एविडेंस बेस्ड मेडिसिन इज when we have to, when the studies are arranged in an order like this, okay, in a hierarchy like this to establish causality. In that, the lowest one is descriptive, which is case report, just for your revision. Okay, also questions come from this topic, case series. Okay, then what is it? What do you have? Ecological. Okay, after ecological, what does it have? Cross sectional. Okay, after cross sectional study, what do you have? Case control. Okay, everybody's revision with this topic. For this one, what do you have? You have prospective cohort. All right, after that you have retrospective cohort. All right, after retrospective cohort, what do you have? RCT. After that, you have systematic review, and finally, you have meta-analysis. This is a different question. This is evidence-based medicine to establish, where the studies are arranged in a hierarchy to establish causality. Okay, but when nothing is known about a disease, or we are doing assessment of any new disease, we do a descriptive study design. Clear? Let's go to the next question. Yes, this is exactly from your previous paper, so read it. A researcher did study on male and female staff nurses and JRs during doing yoga. It was observed that doing yoga led to 25% decreased risk of non-communicable diseases. What is the best statistically significant test to demonstrate the result, or what is the test of statistical significance which you can use to demonstrate the result over here? Very good. So people are marking option D. All right, let's see a few more answers over here. Let's see a few more answers, everybody. Dipesh and Kish has written D. So guys, what is this topic? This topic is asked a number of times in your examination. Okay, this is from the chapter of tests of statistical significance. All right, this year also in December FMG they have given a question. This was from August FMG. Okay, so when we talk about test of statistical significance, it is divided into two types. Okay, parametric, let's write it here. Test of statistical significance is divided into two types. All right, one is parametric test and the other is non-parametric test. Now guys, how did you know that we had to do a chi-square test here? Whenever such questions come, you have to see, are we talking about quantitative variables or qualitative? Whenever we talk about quantitative variables, we will use a parametric test. When we talk about qualitative variables, okay, we will use a non-parametric test. When we talk in terms of means and SDs, we will use a quantitative test. When we talk about in terms of percentages and proportions, okay, we will use a qualitative test. So here we are talking in terms of what? Male and female staff nurse and JRs, yoga and NCD. All right, so yoga, yes, no, and NCDs, yes, no. So we can never measure these in terms of means and SDs. We can only say so many percentage practice yoga and so many percentage did not suffer from NCD, or the risk of NCD decreased. Are you clear? Therefore, here the answer was chi-square test. ANOVA, unpaired and paired. All these are examples of parametric test. Clear? So parametric test is also used for a normal distribution. Non-parametric test is used for a skewed distribution. Now, which test is more powerful? Just an additional MCQ for all of you. Is parametric test more powerful or non-parametric test? Can you tell me in the comment section? Is parametric test more powerful or non-parametric test more powerful? Parametric test, okay, they are more powerful, okay, than non-parametric test. Clear? Very good, Kish. Parametric tests are more powerful. So in subsequent sessions that will be held tomorrow and day after at 6 p.m., I will give you more questions from these topic, and we will again look at the types of tests that are included in this question. Okay, let's see another diagram. Another question. This is again a very commonly asked question. The following diagram is used to show the trend of events with passage of time. Okay, trend of events. So is it histogram, frequency polygon, line chart, or pictogram? Let's see your answers. Is this a frequency diagram? Is it a frequency polygon, histogram, line diagram, or pictogram? So I can see Sujin is saying B, Sumita is saying B, Sanjay is saying C. So there are a lot of you who are giving mixed answers over here. Okay. Whenever you represent trends of event, okay, जब भी आप represent करते हो, you talk about trends of event, okay, with passage of time. All right, trends of event with passage of time. It is always depicted by a line diagram, okay, or what, it is always depicted by a line graph. Okay, so whenever you depict, you know, trend of event with passage of time, it's given by line diagram. What does this trend of event mean? It simply means that suppose abhi it's 2020, so this is Jan, all right, this is Feb, this is March, this is April, aise karke till December. Okay, how were the occurrence of measles cases in a particular town or city? जनवरी में इतना था, फेब्रवरी में इट रोज, ऑलराइट, मार्च में इट अगेन फेल, अप्रैल में इट अगेन रोज, मई में इट अगेन फेल, then June में it's rising, July, just an example for all of you. Okay, so this is the trend of event with passage of time. Like now if I give you a question like what is the best way to represent COVID-19 cases, it's by a line diagram, or it is also known as a line chart, or it is also known as a line graph. Are you understanding, everybody? Okay, so here we represent the trend of event with passage of time. Now what is a histogram, guys? What is a histogram? In the comment section, anybody, what do you understand by a histogram? Is it a quantitative method of data representation or qualitative method? Data representation has two methods, quantitative and qualitative. Okay, histogram is again a quantitative method. What does histogram represent? It represents, very good Vignesh, it is continuous, it is used for representation of continuous quantitative data. Clear? Like, can you give me an example, everybody? Give me certain examples of continuous variables. I don't remember them. Just help me brush up my memory. Give me certain examples of continuous variables. Yes, continuous variables ka example hota hai like height, okay, like weight. Okay, now somebody's weight could be 20 kg, 20.1, 20.2. So they are continuous variables. Okay, that is why this is how a histogram looks like. There is no gap in between. Can you see this figure? Okay, I've also shown you the images in previous classes. So this is a histogram where there is no gap in between. Now, all right, suppose like this. Now if you join the midpoints of these histograms, okay, like this, if and you draw a line like this, okay, and then what you do, you close it from all ends. Okay, this becomes, what is this known as, what develops in front of a histogram, anybody? This is known as frequency polygon. Clear? What develops in front of a histogram, that is known as frequency polygon. Some of you went and marked the answer as frequency polygon for this. This is not. A polygon is a shape. It has to be closed from all the ends. Very good. Okay. Pictogram is an pictorial representation. So that's a qualitative method. Now, yes, sorry. Okay. All right. Understood, everyone. Let's go to the next question, guys. The next question is, what is the numerator in perinatal mortality? Post neonate death with weight 2.5 kg, early neonate death with weight 1000 grams, abortion less than 500 gram fetus, or stillbirth of fetus more than 500 grams. Can you tell me the answer to this? What do you understand by perinatal mortality? Is it post neonate death with weight 2.5 kgs, early neonate death with weight 1000 grams? I can see some of the answers. Good Sanjay, good Arun. Perinatal mortality. So what is the meaning of perinatal period? Okay, so perinatal period, guys, means late fetal death. All right, late fetal deaths plus early neonatal death. Okay, late fetal death plus early neonatal death per 1000 live births. Now late fetal death over here means what? Late fetal death over here means death up to how many weeks of gestation? Death up to 20, like death from 28, sorry, death beyond 28 weeks. Okay, beyond 28 weeks, like the cutoff is 28 weeks. So death beyond 28 weeks of gestation plus early neonatal matlab first 7 days of life. Okay, per 1000 live births. Clear? So this is the perinatal period. Now to be called as perinatal, okay, it has certain criteria to fulfill. One is the weight of the baby should be how much? The weight of the baby should be at least 1000 grams. The length of the baby should be how much, guys? Length of the baby should be at least, very good, at least 35 centimeter, and period of gestation should be 28 weeks minimum. All right. According to WHO, however, the perinatal period may, what is the period of gestation? If I ask you, according to WHO, what is the period of gestation for, according to WHO, okay, what is the period of gestation which can be called as perinatal, which can be called as, yes, this is per thousand, which can be called as, very good, that is 22 weeks. All right, this is according to WHO. Clear, everybody? No, 22 weeks. All right. If I asked you guys, what is stillbirth rate? Just for another MCQ that we might get in future exams, since they ask you about perinatal, they can also ask you about stillbirth. So what is the definition of stillbirth rate, perinatal mortality rate, या stillbirth rate? इसमें please remember, it is late fetal death, but the denominator is total births. Okay, live birth also as well as stillbirths also. Clear, everybody? For stillbirth, the numerator is the same, late fetal death, but the denominator, it is per 1000 total births. Okay, in this total births, we also have live birth plus stillbirth. Are you understanding, everybody? Give me a thumbs up if you've got this question into your heads. This is very important. Perinatal mortality, what is perinatal period and all that. Okay, let's see one or two other MCQs. Okay, tell me this one. It was noticed that children of separated parents are more addicted to drugs as compared to children with normal parents. A study reported that chances of addiction among separated parents is higher as compared to non-separated parents. This study design is case control, cohort, retrospective cohort, or an RCT. Now this is just from your December FMG. So can you tell me the answer? It's a simple one, very easy. So since two consecutive FMG papers, they are giving you such questions. One that we, tomorrow you will again see a question from August FMG, which was a similar type of, today you have to answer this one. Good, everyone. So here it straight away tells us that we have cases, okay, children of separated parents are more addicted, all right, to drugs as compared to children with normal parents. Chance of addiction among separated parents is higher. That means these are your cases, separated parents, and non-separated are your controls. Then you go back in time to assess the exposure history. That is, how many were addicted and how many were not addicted. Now guys, why can't it be a cohort study? Now it cannot be a cohort study because you cannot wait for such an outcome to occur. You cannot see that one group of students is addicted to drugs, one is not, and then I don't know for how long you'll have to keep following them to see to acknowledge the duration till which separation between parents occur, all right, between the husband and wife. Did you understand this? So it's best, so for rare outcomes, all right, remember this golden point. For rare outcomes, what is the best study design? Anybody in the comment section? This is a golden point. For rare outcomes, or if you say rare diseases, what should be, which type of study design we should go for? We should always do a case control study design. Case control study design for rare outcomes. Clear, everybody? Okay, let's see a few more MCQs. Okay, so here the question has been a little hidden. I will write it. In a sub-center population, crude birth rate is 25. What is the question is, what is the minimum number of expected pregnancies? So let me see how you solve this. This is again from your December FMGs, and they give such type of questions from preventive obs and gynae. Let me see your answers, please, everybody. In a sub-center population, crude birth rate is 25. What is the minimum number of expected pregnancies? What is the minimum number of expected pregnancies? All right, I can see Kish giving his answer. Some of you, good, good. Most of you have attempted it, good. So what is the question that says, what does this question say? In a sub-center, crude birth rate is 25. What is the minimum number of expected pregnancies? ठीक है, crude birth rate क्या होता है? Anybody? What is crude birth rate, guys? This is number of births, है ना? Number of births per thousand what? Per thousand mid-year population. All right. When is mid-year population taken into consideration? Anybody put in the comment section. This is also an MCQ which has been asked in your examination. Mid-year population is considered on 1st of July. All right. So number of births per thousand mid-year population. This is the simplest measure of fertility. All right. So this question says, for every 1,000 population, birth rate is 25. Now, what is the population of a subcenter in cases of plains? Unless and until it is mentioned, you will always consider the population for plain areas. So, for every 5,000 population, what will be the birth rate? 25 by 1,000 into 5,000. So, ये कितना हो जाएगा? 125. Now, is 125 your answer? No, 125 is not your answer. Why? Because every lady who gets pregnant is not necessarily will remain pregnant. She might not, maternal deaths are always bound to happen, one or two here and there. All right. So what happens because of this? We always have to consider 10% pregnancy wastage factor in these questions. Okay. So what is this 10% of pregnancy wastage? Which means to calculate the number of expected pregnancies. Okay. What you have to do to this 125. All right. You have to add up 10% of 125. This is pregnancy wastage factor. So this is 125 plus 12.5 approximately 13. So ये कितना हो जाता है? 138. Clear everyone? Okay, so this is very important. Good. I hope all of you understood. If I went one step ahead and gave you the question, minimum number of pregnancies registered, what will be your answers? Minimum number of pregnancies to be registered with an ANM. Can you tell me your answer over here? Minimum number of pregnancies to be registered with an ANM. तब आपके आंसर क्या हो जाता? If after calculating the expected number of pregnancies, we have to find out the minimum number of pregnancies to be registered with an ANM. Very good, Sumita and Vignesh. For any given time, 50%, that is whatever is the expected number of pregnancies, we have to register 50% of this at any given time. Okay, so it is 138 by 2. So 2 6 are 12 and 69. Are you clear? So this is two ways in which the question could come. Minimum number of expected pregnancies, and the second question is minimum of number of pregnancies that should be registered with an ANM. Clear? So it is 69. Okay. All right. Now let us do one more question. Yes, this is again from your December paper only. Who is responsible for conducting active malaria surveillance? Multipurpose worker female, male multipurpose worker, ANM or ASHA? Can you tell me the answer to this? Who is responsible for conducting active malaria surveillance? Is it a multipurpose worker female, a male multipurpose worker, ANM or an ASHA? Let me see your answers, everybody. Good. This is a repeated topic. Okay, many times, many times. Okay, repeated topic. Many times they have given you this question. Okay, who does active malaria surveillance? It is a male multipurpose worker. What is a female multipurpose worker also called as? What is her other name? Female multipurpose worker. And where are these multipurpose workers placed, guys? Anybody in the comment section? What is a female multipurpose worker also called as? Very good, Vignesh. Female multipurpose worker is also called as an ANM. Okay, and they are placed at, both of them are running a sub center where no medical officer is placed. Okay, what is the existing staff in a sub center? Now please remember, let's do one or two one liners for sub center. Sub center is for a population of 1 per 5,000 in plains, again one of the most commonly asked topic, and 1 for 3,000 population in hilly areas. Okay, there can be two types of subcenter, either an A or a B. A subcenter is delivery conducted in an A subcenter? No. B subcenter mein deliveries are conducted. Alright, so based on the delivery, we can have A and we can have B. Now, existing staff over here is 3. All right, one male multi-purpose worker, one female multi-purpose worker, and one safai karamchari. But what is the proposed staff over here, guys? It is actually 4. If it's a type of subcenter where delivery is also being conducted, then the proposed is 4, because then we would want 2 female multi-purpose workers. Clear? Female multi-purpose workers never conduct active malaria surveillance. It's only the male multi-purpose workers who are doing it. Is it clear? So, these were the questions that we've discussed today. I hope you enjoyed this session. Tomorrow again, I will come live at 6 p.m. with another set of questions from your previous year FMG papers. All right. And day after, also on 31st, I will come at around 6 p.m. All right. So both the days we will have a look at some of the FMG questions. Thank you all so much for attending. Just before we call it a day, I just want to tell you one thing once again, that don't worry, keep studying, and if anybody is interested to attend, tomorrow we have a free live class at 10 a.m. all right, on Unacademy app. We'll be discussing AIMS previous year PSM papers, but it will be equally effective for all of you to attend. All right, also on 31st December of 10 at 10 a.m. I have a session on vaccination with MCQ and images, so do attend it. It's a much requested session, so you can it will be a totally free session, so you can use my code PSM10 to enter the class, absolutely free. All right, and also at 3 p.m. we will have a fun with PSM rapid one-liners with PSM images on 31st of December. Okay, and just for all of you, a little heads up, we have launched a FMG batch course on Unacademy, which has started just on 14th and 28th of December. So if any of you students are looking ahead for June FMG, you can subscribe to this batch course. You can use my code PSM10, and these are your wonderful educators who will be teaching you live on the platform. Okay guys, so thank you so much for attending, and be safe and don't stress. All right, I'm sure you can do it. Just be consistent, keep working hard. All right, don't think about that whether you will pass or you will not. That is never under our control. All right, just be focused. What is under your control is to put in your hard work. Not just hard work, it's now that we have to put in smart work. All right, you should work smartly, be consistent, have patience, and you will definitely get to what you want in life. Okay everyone, thank you so much for attending. I will see you tomorrow at 6 p.m. again with another round of MCQs. Bye bye.